briefing about the coronavirus pandemic. We're taking you live for this breaking news.
And City Manager Jared Miller. At this time, let me go ahead and turn it over to Amarillo Pro Tem Frida Powell.
Thank you, David. Good morning, Amarillo. I want to welcome everyone to the City of Amarillo's Friday News Conference for the latest in COVID-19 information updates. Let me begin by saying thank you to Governor Greg Abbott for coming to Amarillo on Wednesday of this week. The governor's news conference was informative and helpful, and Amarillo appreciates the assistance the state has provided as our city continues to make progress in stopping the spread of COVID-19 in our community. I'm also grateful for our area representatives that attended as well. I have been encouraged by what the data and numbers have revealed the past few days. As the governor said on Wednesday, an increase in positive test numbers is definitely possible, if not expected. As testing continues to increase at the different locations within our meatpacking plants, we will definitely see our numbers rise. However, the numbers from the past few days have been promising for Amarillo. As Amarillo begins today the next phase of reopening businesses and activities under Governor Abbott's Executive GA Order 23, I am confident that our residents will continue to adhere to the policies and recommendations that have helped our city respond to the COVID-19 outbreak, such as wearing your mask. My mask protects you, your mask protects me. Social distancing and washing our hands on a regular basis. I want to thank our businesses, our business owners, and employees for their patience and understanding the past few months. Most of all, I want to say thank you to all of our first responders and our last responders, our heroes. When we call, they are there, and their jobs are far from easy. They work long hours around the clock to rush to scenes, helping complete strangers without even thinking twice. This has been a difficult and trying time for many, but Amarillo has responded in an impressive style to adversity as it has many times in its past. As our city continues to reopen, we must manage the risks associated with COVID-19. Our city must continue to be united and working together as a team to mitigate the outbreak of COVID-19. Now, as I come to a close, this has been weighing very heavy on my heart. So I asked our city to reach out to the family of George Floyd and also the city of Minneapolis, and I ask for your prayers for them. And I do want to say that I am so grateful that we live in a city that has focused on community policing and building relationships between police and citizens they serve. Our new police chief, Chief Birkenfeld, is committed to establishing and continuing these relationships. And our officers, hear me when I say this, they care deeply about our residents and the Amarillo community, and they understand that the kind of behavior exhibited by those officers in Minneapolis is not acceptable in Amarillo. So I ask for your prayers for the Floyd family as well as Minneapolis and for our city. Thank you.
Thank you, Mayor Pro Tem. At this time, we want to go to Public Health Director, Casey Stoughton.
Thank you. Good morning. As of yesterday, there were a total of 2,934 cases of COVID-19 reported in Potter and Randall counties. 2,276 in Potter County and 658 in Randall County. We have a total of 796 recoveries and 34 deaths reported in Potter and Randall counties, which leaves us with 2,104 active cases. Each of these cases represent a unique individual. Testing at JBS is starting, those results are starting to return. We have a total of 821 people who were tested from Potter and Randall counties. 27% of those test results were negative, 4% were positive, and 69% of the tests are still pending. For the total numbers of the people tested, the Texas Department of State Health Services would be the best source of that information, as we here at the Amarillo Public Health Department only have the information for those people who reside in Potter and Randall County. Amarillo Public Health and Amarillo Fire Department completed the testing of all nursing home residents in Potter and Randall County this week. A total of 2,127 people were tested in the nursing homes. Of those tests, 71% were negative, 6% were positive, and 23% are still pending. There were 14 nursing homes in that group that were tested, and 10 of the nursing homes have positive COVID tests identified. We anticipate an order for assisted living facilities and group homes to follow. Our fire department and public health department have been proactive and have been asking assisted living and group homes if they would like to go ahead and be tested. Many of those have said yes, and so we're moving on to those types of facilities in anticipation of the order from the governor. As with all mass testing events, data comes in different formats and at different times. Our team works quickly to tabulate the information to begin contacting the individuals and working to get the information to the public. The information is provisional, so there may be slight variations in the data as our team works to clean the data during data entry. I also want to take a moment to celebrate with Northwest Texas Hospital and Ms. Miller on her recovery from COVID-19. Congratulations, Ms. Miller.
Thank you, Casey. This time, I want to go to Dr. Scott Milton.
Yes, I would like to remind everyone to continue to wear their mask. I think the governor at the pre-conference meeting remarked about the fact that all of us in the room were wearing a mask, and he thought that may have been the first time he noticed that. So I think that's very important. In terms of numbers today, specifically the hospital numbers, these are actually mainly from yesterday. I haven't heard from Brian and Mike this morning. At BSA, there were a total of 30 individuals that were COVID positive, which is slightly up from earlier in the week. There were 10 on the ventilators, and there were 14 in the intensive care unit. There were 16 patients in non-ICU settings. The ventilator capacity was about 60% at BSA, and the MICU capacity was up to 96%. At Northwest Texas Hospital, yesterday there was a total of 22. I think that's down to 21 this morning. There were 5 ventilators in use yesterday. There were only 4 today. Around 9 people in the ICU and 13 in the non-ICU setting. The ventilator use was around 28%, and the ICU capacity was around 61%. Thus far, we have been distributing remdesivir at both hospitals, and I'm involved in the evaluation of those patients at both hospitals. The numbers at Northwest include a total of 15 treatments thus far. We added 1 more this morning. There are 12 that are ongoing right now in the hospital. There have been 2 discharges to home, and there's been 1 associated death. At BSA, those numbers are around 5 to 6 total, and I haven't received an update on them over the last day or 2, so I can get more information about that maybe on next Wednesday. Thank you, Dave.
Thank you, Dr. Milton. This time, let's go to City Manager Jared Miller.
Thank you, Dave. I want to remind everyone that the drive-through testing center remains open. If you feel sick and have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. The Executive Order GA-23, today is a big day for this area in that we, over this week, today and over the weekend, will be fully caught up with the rest of the state as far as having everything open that the rest of the state has open. Slightly different numbers as far as the percentages allowed. I'm going to go into a little bit of detail on that right now. So we're under the next phase of the governor's executive order GA-23. Beginning today, massage establishments, licensed massage therapists, tattoo studios are allowed to open. They do have to ensure at least 6 feet of social distance between workstations. Dine-in restaurants can move from 25% of occupancy to 50% of occupancy. Bars, bowling alleys, bingo halls, and simulcast racing are allowed to open, and they may operate at 25% of occupancy. The Amarillo Zoo is going to open its outdoor areas at 25% of operating capacity. Indoor areas of the zoo are going to remain closed. Beginning this Sunday, May 31st, youth sports programs and recreational sports programs for adults may begin to practice, although no games or competitions can be held until June 15th. Youth camps, such as summer camps, will also be allowed beginning on Sunday, along with professional sports. No spectators will be allowed for professional sports under GA23. For more information about how the governor's working to open Texas back up, I encourage you to visit gov.texas.gov/OpenTexas, or you can contact the governor's office main switchboard at 512-463-2000. I want to quickly touch on a couple of city facilities. I want to remind our customers the utility billing department will accept walk-ins at Amarillo City Hall, adhering to social distancing policies. Utility billing and vital statistics customers can also utilize curbside payment services. Customers wishing to utilize the service should enter the City Hall parking lots from Buchanan to leave payments in a drop box, and from Johnson Street to pay by credit card. The building safety department is also open and following social distancing policies at the Sims building. Beginning next week, we're going to be moving to one press conference per week. That'll be on Wednesdays with the same participants that we've had historically on Wednesdays. So it'll be a very full panel to address all COVID-related issues on Wednesdays moving forward next week. We will do more press conferences if the situation warrants. So if we have a big bloom in numbers, or if we have significant change in how coronavirus is being experienced in our area, we'll do more press conferences if necessary. But starting next week, we're going to be having press conferences on Wednesdays only. We'll also be discussing coronavirus during our council meetings on Tuesdays. So we'll have two scheduled times where we're going to be talking about it. But from a press conference standpoint, we're going to be doing those on Wednesdays only. That's all I have, Dave.
Thank you, Jared. This time, we want to open it up to questions from our local media. If you have a question.
All right, and we will give you updates throughout the day and on our website at myhighplains.com. We'll continue to live stream this conference on our Facebook page. For right now, we'll take it back to regularly scheduled programming.
Fantastic. So happy Friday, everybody. I guess my first question would be for Casey. Do we have, regarding the senior living facilities that the individuals who have been tested, do we have the discrepancy between how many of those positives were asymptomatic, how many were symptomatic and such?
So we're still working through some of that, working on through the contact investigations and those types of questions. So I hope to have more information related to that next week. So I hope to have more information next week.
Okay, and with the nursing home facilities, you said that 10 of them have a positive COVID-19 patient. What is, I guess, the what is your suggestions to those facilities of how they approach this situation now that they do have a positive in the facility?
Sure. So I think the information is really helpful to them. They we tested both staff and residents. So there may be situations where there are not necessarily positive residents, but positive staff, or vice versa. And so I think it's important to know, first of all, if there's positive staff, then we can quarantine those staff and take them out of the facility so that it slows the potential transmission in the facility. If there are positive residents, then we can cohort those residents into a different, kind of away from the well residents, so that, again, the whole goal is to slow the transmission of disease in that facility. And so the information is helpful to the facility so that they know how to best care for their residents. The number one goal is to keep residents and staff safe. They need to be wearing PPE at all times. Masks are the key, both in nursing homes and out. And so I think that the more information we have, the better armed we are to slowing the transmission of COVID in our community.
Absolutely, absolutely. And at the governor's press conference on Wednesday, he said that he would be surprised to see if there wasn't a spike regarding the JBS plan and potentially this the nursing homes. I mean, do you have any I don't know if prediction is the right word, but any insight on when that spike may occur? Would it be early next week?
So, here in our community, we still have around 70% of the tests still pending from JBS, and we have about 23% of the tests still pending from the nursing homes. I think that we're looking good so far with 4 and 6% positivity rates. Currently, we still have a little ways to go. Again, masking is so important, hand washing is so important, and then that social distancing, I don't know that we can say that enough right now. But I think that we're still, I would imagine in the next week or two, we'll have that information, and then it will just be moving forward with those prevention tips.
Absolutely, absolutely. And the last question I have is, even with the hosting the news conferences once a week now instead of 3 times a week, does that change the schedule any for the distribution of the report card?
No, we will continue to put the report card out on our current schedule, and we always have the dashboard as well. So we want to make sure that people continue to have access to the information that they need, and so those pieces of information, that won't change.
Absolutely. Well, have a good weekend, guys. Thanks, Dave.
Thank you, David. This time, let's go to Ariana Martinez of News Channel 10. Ariana, how are you?
There we go. Can you hear me? I'm good.
Yes, we can. How are you, Ariana?
I'm good. Thank you. So the first question is probably for Casey. How will testing at assisted living facilities work, and who will pay for it?
So that will work the same way that the nursing home testing did. So we're working with the fire department and the facilities to accomplish that goal. And then the state has told us that they will work with us on that, on the cost of that testing. So just exactly like the nursing homes did.
Perfect. And have there been any local cases of pediatric inflammation related to COVID?
Not reported to the health department. Dr. Milton, you may have more information on that.
No, I don't. I have not heard of any cases that have been reported to me at all.
That's good news. Are local COVID patients showing susceptibility to blood clots?
Yeah, I'll comment on that. Since this outbreak occurred starting, 6-8 weeks ago, when we really started seeing a rise in our hospital patients, it was very clear that the clotting disorder that was being described was happening to patients that we had in the hospitals here. So the answer to that is yes.
Okay. And what are the common causes of death in COVID patients locally?
Well, so it's the most common cause, obviously, is respiratory failure. This illness, it's an unusual illness in that people many times will develop renal failure as well. In other words, their kidneys will fail. And the causes for that, and the reason for, I don't think that they're well understood. What's pretty clear is that they develop what's called a cytokine storm. And cytokines are certain proteins that are produced by the body that are kind of part of the inflammatory process. And it seems that it's out of control. And so people surmise that it damages the organs by this uncontrolled inflammatory response. So I think as time goes on, we'll learn more about that. But primarily speaking, this is a pneumonia. So many times their lungs will just fail.
And going back to the blood clot question, Dr. Milton, do we know why? Is it a certain medication? Is it just the way the disease works? Or do we know why the blood was clotting?
I don't think anybody knows why. I would say, first of all, there are other types of infections, and many times people with an overwhelming infection for lots of different reasons, including bacterial infections, can develop what we call a coagulopathy, which means that the clotting system becomes disorganized, and potentially damaging. So this is not necessarily unique to this. It just seems to be a fairly significant and common occurrence with COVID. So it's part of the, I think it's part of the, what we call the coagulation cascade, and which is kind of tied into the inflammatory response that people have when they get exposed to many different types of infections.
Interesting. Thank you, Dr. Milton. And this last one's probably for Frida Powell or Jared Miller. Will Amarillo remain 1 week behind the rest of the state for reopening, or will we start opening with the rest of the state?
Well, according to the current order that we're on, we're caught up now. We don't have any indication that future orders will have us using a different timeline, but I don't have any indication that they won't. The governor has not spoken to that. But the fact that we're caught up now would indicate to me that with the exception of the differences in percentages, that we will stay on the same schedule as everyone else. However, we are still operating at lower percentages with some of our operations.
Perfect.
To sum it up, I don't expect us to be on a different schedule than everyone else from this point forward, absent any type of different experience that we might experience with any type of unforeseen blooms.
Perfect. Thank you. That's all I have. Have a good weekend, everyone.
Thank you, Ariana. This time, let's go to Paula Albaran of Telemundo.
Good morning.
How are you?
Good, thank you. So I have a question related unemployment in Amarillo is at an all-time high, but are you guys optimistic in that numbers could go down with the city reopening?
Yeah, I would say yes. We are optimistic about that. As our businesses come back and as they get back to full operation, we're very hopeful that unemployment is going to be a temporary decline or increase in unemployment, and that we'll move back to full employment very quickly. Prior to coronavirus, we were one of the highest employment areas in the state and in the country, with employment levels being well below, or unemployment levels being well below what is considered full employment. So we were doing extremely well there, and I anticipate that we'll move back to full employment very quickly.
And I think this question is also for you, Mr. Miller. What can we expect as Amarillo bars reopen with new guidelines tonight? And some of them, we had information they opened yesterday at midnight.
I have not heard that. However, we have heard that some had opened prior to that, and we worked with those bars to make sure that everyone understood the schedule that the governor had laid out. I would anticipate that they will be very respectful of the governor's orders, but we'll also be working with them to ensure that everyone is observing the requirements of the governor's orders and responding to complaints or concerns that we receive from citizens who observe that they might not be operating in accordance with the orders. But we're we have had very good track record so far with businesses being respectful of the governor's order, and I expect the same will continue.
And my last question is, beginning today, many businesses are opening as well, like massage establishments and tattoo studios. What are you expecting as well for those kind of businesses here in Amarillo?
Well, the governor has put out some pretty good information on businesses on how they can open. He's also got, of course, in GA23, guidance about social distancing. I anticipate that one of the things we're trying to do, and we're working as hard as we can to do through our environmental health department, is work with as many businesses as possible to provide input, even at their request, to come look at their establishment and provide some recommendations on how they can best get working and get open, bringing in customers while still observing the governor's orders. So we've provided a lot of proactive assistance at the request of businesses. We're absolutely open to continue doing that. And so just like I was talking about earlier with the bars, I expect that these businesses, they want to get open, and they also want to make sure that they're doing it in a safe and responsible way that's also observing the governor's orders. So we'll assist with that in every way possible.
Thank you very much.
Thank you, Paula. This time, let's try it again. Let's see if we have Aaron Langston from KMR Channel 4. Aaron, how are you? Okay, Aaron, we appreciate it. That's all the questions we have from media, and that concludes our news conference for today. Once again, we will be doing weekly news conferences on Wednesday at 11 a.m. related to the latest in COVID-19 information and updates. This is David Henry. I'm the Communications Manager for City of Amarillo. We will see everybody next Wednesday.